I am Dr. Ankita Chitre and I work with Tata Memorial Cancer Center, Varanasi, and I am a consultant physiotherapist. I'm going to talk about prehab and rehab in cancer patients pertaining to lung cancer. So when we talk about lung cancer, it is not only about rehabilitation, but it is something about prehabilitation where we condition the patient before the surgery, work on their aerobic capacities. There are a series of checklists, a series of tests which are supposed to be done. For example, a 6-minute walk test in which a patient walks for 6 minutes, and then we calculate the target heart rates and the walking capacity. If it is 60 to 70%, then we from our side label that the patient is fit. If not, then we work on the prehab of the patient where we monitor them for the aerobic capacities, then the strengthening. And once the patient is conditioned, then we ask our surgeons. So we have an excellent team of surgeons who we can put across that the patient is fit for surgery or not fit for surgery. So once the patient is fit for surgery, then once the patient comes to the ICU setup, the main goal is an ERAS protocol which we follow, that is enhanced recovery after surgery. So the first thing is the in-bed physiotherapy, that is taking care of the chest complications, secretion, drainage with different physiotherapy maneuvers. After that, making the patient walk, and then either the patient is on O2 or off O2. And there are several things, several parameters which we monitor. After monitoring of those parameters, we see to it that from walking we progress to staircase climbing. And then after that, we see to it that in this, even the patient is following the protocol, even post-operative, in the 3 months phase. And then we have sessions where the patient comes to us regularly for follow-ups. And in the post-operative phase, we see to it that the patient is not only doing the regular chest physiotherapy, the drainage secretions, the expiratory exercises are also important. Then the strengthening of the chest. There are a few patients which cannot afford extremely expensive devices, expiratory devices, inspiratory devices. So we give them a simple balloon or a straw exercises to strengthen their lungs and enhance the lung capacities. So basically in a lung cancer patient, what we target is the main goal is working on the aerobic capacities and the maximum optimal functioning of the patient and putting the patient back to their normal functioning. So that is the main key goal of a physiotherapist. And since an oncology therapist, the main criteria which we look into is even when the patient has a set of different comorbidities to maintain an optimal level of functioning. And to know more about lung cancers, please join and subscribe to the channel of Lung Connect. Thank you.